Welcome back, everybody, for another deep dive. You know we love to dig into those topics you might not think about every day, and today is no exception. We're talking all about venous return.
Venous return.
That's right. How that blood gets back to the heart after it's done its rounds, delivering oxygen and all that good stuff.
Right.
And you might think the heart does all the work, but
Oh, there's more to it.
there's a lot more to the story than that.
Mm-hmm.
And luckily, we've got the perfect guide thanks to this physiology handout by Dr. Rasha Eldeeb.
It's a great resource.
It really is. It's really fascinating stuff.
Yeah.
So, okay, let's jump right in. Imagine this. I'm stuck on a long flight. My legs are starting to feel like they're filled with lead.
Oh, yeah.
What's the deal with that? Is that connected to venous return?
It totally is. You've got to think about the skeletal muscle pump. It's one of the things that really helps get that blood moving back up to the heart.
Okay, the skeletal muscle pump. So what is that exactly?
Basically, when your muscles contract, they squeeze the veins and help push the blood upwards.
Oh, like an extra little pump in your legs?
Yeah, exactly. But when you're sitting still for hours on end, those muscles aren't contracting much, so that pump isn't working as well.
So that's why they're always telling you to get up and walk around on those long flights. It's not just about avoiding boredom.
Nope, it's good for your circulation. Moving those legs helps get that blood flowing.
Okay, so movement is key.
No.
But I'm looking at Dr. Eldeeb's notes here, and there's something else that helps venous return too.
Oh, yeah. There are a bunch of different mechanisms.
It's wild. She mentions breathing.
Breathing.
Breathing, is that right?
Mhm.
Does breathing actually play a role in getting blood back to the heart?
It really does. It's called the respiratory pump.
The respiratory pump. Okay, I'm intrigued. Tell me more.
Think about it this way. Your chest cavity is kind of like a gentle vacuum cleaner.
Okay.
Every time you inhale, your diaphragm moves down, and that creates a slight vacuum,
Ah.
and that helps pull blood upwards towards the heart.
So those deep breathing exercises everyone's always talking about, are those actually helping with circulation?
They definitely can. Deep breaths create a stronger vacuum effect.
Oh, I see.
So yeah, if you've been sitting for a while, taking a few deep breaths can really help boost your venous return.
Wow, who knew? Okay, so we've got our muscles helping out, our breathing helping out, but Dr. Eldeeb also mentioned something called right atrial pressure.
Right atrial pressure, yeah.
What is that all about?
Well, think of right atrial pressure, or RAP for short, as the end point for venous return. It's basically the pressure in your heart as it's receiving blood.
Okay, so like a measuring stick for how much pressure is there,
Exactly. And, blood always wants to move from high pressure to low pressure.
like water flowing downhill.
Exactly.
Yeah.
So the lower the pressure in the right atrium, the stronger the pull for blood to return.
So low pressure is good in this case.
For venous return, absolutely. It's like a vacuum.
Okay, got it. But there's another pressure she mentions here.
Oh, right.
I mean, circulatory filling pressure, or MCFP?
Yeah, mean circulatory filling pressure.
That one sounds a little more complicated. What's that all about?
It might sound complicated, but you experience MCFP all the time.
Really?
Yeah. Think about when you hang upside down,
Oh, yeah.
all that blood rushes to your head.
Yeah, and it feels kind of weird.
That's MCFP in action. Gravity's playing a big role there.
So gravity is a factor here.
Oh, absolutely. Gravity is always affecting how blood flows back to the heart.
Makes sense.
But MCFP is also about how much blood you have and how much space it has to move around in. Think about your blood vessels as a network of pipes that can constrict or dilate.
Oh, so if my blood vessels are more constricted, does that mean the blood is pushed back to the heart with more force?
Exactly. When those blood vessels constrict, it increases the pressure, and that means more blood gets pushed back to the heart.
So things like stress, which can make our blood vessels constrict, that would actually boost venous return.
It could, yeah. But then on the other hand, something like an allergic reaction where your body releases histamine, that causes your blood vessels to dilate.
Oh, right.
So the pressure drops, and that could hinder venous return.
It's amazing how much is going on in there.
Yeah.
So we've got muscle squeezing, lungs pulling, pressure gradients, gravity.
That's a whole symphony going on inside us.
There's got to be more, right? Is there anything else contributing to this venous return party?
Oh, yeah. We haven't even talked about those arterioles, the tiny blood vessels that lead into the capillaries. They're like gatekeepers, controlling how much blood flows through, and that ultimately affects how much blood returns to the heart.
Oh, wow. So even more complexity.
But that's a topic for our next segment.
This is already blowing my mind. I can't wait to hear more.
We've been talking about all these different factors influencing venous return.
Yeah, it's pretty wild.
And one thing we haven't touched on too much yet is the effect of gravity.
Oh, right. Gravity. You mentioned earlier how it affects that mean circulatory filling pressure.
Exactly. And, it especially plays a big role when it comes to the blood in our heads.
Yeah, you mentioned something about the pressure in the head actually dropping below atmospheric pressure when we stand. That sounds a little freaky. How is that even possible?
It's definitely counterintuitive,
Yeah.
but you got to remember gravity's always pulling that blood downwards.
Right.
So when you're standing up, it's working against the blood that's trying to get back to the heart from your head.
Mm-hmm.
And that downward pull can actually cause the pressure in those veins in your head to dip below the pressure of the air around you.
Okay, so if the pressure outside those veins is higher than inside, wouldn't that make them collapse? Like a straw with
But
all the air sucked out of it?
you'd think so, right? But luckily, we've got this built-in protection system,
Oh,
our
wow.
skulls.
Our skulls.
Yep, the rigid structure of our skull actually prevents those veins from collapsing.
So it's like a helmet for our veins.
Pretty much. It's a good thing, too, because you can imagine what would happen if those veins collapsed every time we stood up.
Yeah, not good.
And this actually has some important implications for neurosurgery.
Oh, really?
Absolutely. Imagine a surgeon operating on the brain while the patient is sitting upright. If they accidentally nick a vein, that lower pressure inside could actually suck air into the bloodstream.
Oh, that's not good.
Not good at all. It's called an air embolism.
Air embolism. Okay. That is officially going on my list of things to avoid. But seriously, it really makes you appreciate the skill of these neurosurgeons.
Yeah, they have to be incredibly careful.
So I'm guessing positioning during surgery is super important then.
Absolutely. Keeping the patient lying down helps minimize that pressure difference between the head and the atmosphere.
Oh, that makes sense.
And that reduces the risk of those air embolisms.
Wow, it's amazing how these seemingly small details can make such a big difference in these situations.
Yeah, the body is a complex system.
So we've talked about how gravity can pull blood down. But what about other forces? You mentioned earlier that linear acceleration can affect venous return too.
Oh, yeah, that's right. Think about what happens when you're in an elevator quickly going up.
Oh, yeah?
You feel that force pushing you down, right?
Yeah, like I'm getting heavier.
Well, that same force is pushing your blood downwards, too.
Toward my feet.
Exactly. It basically makes it harder for that blood to return to your heart from your lower body.
So is that why you might feel lightheaded or even faint if you go up too fast in an elevator? Like your brain isn't getting enough blood?
It definitely contributes to it. And the opposite can happen when you rapidly descend.
Oh.
That blood rushes towards your head, and that can cause discomfort or potentially even more serious problems.
Interesting. It's wild to think about how sensitive our bodies are to these changes in force and direction.
It really is. Your body is constantly adjusting to keep things in balance.
Okay, so we've covered the pressure side of things pretty well now, I think. But let's go back to something you mentioned earlier, those tiny arterioles that act like gates.
Right, the arterioles.
How do they fit into this whole venous return picture?
So remember how arterioles are those tiny blood vessels that lead into the capillaries? Well, think of them as the gatekeepers of blood flow.
Gatekeepers.
They basically control how much blood enters the capillary beds.
Oh, those tiny blood vessels where the oxygen and nutrients get exchanged with the tissues.
Exactly. So if the arterioles constrict, it's like closing the gate. It reduces blood flow, and that means less blood is going to return to the heart.
Okay, makes sense. But is that always a bad thing?
Not necessarily. Sometimes that constriction is actually beneficial.
Oh, how so?
Well, for example, if your blood pressure suddenly drops, your body might constrict the arterioles in less critical areas to redirect blood flow to more vital organs like your brain and heart.
So it's like a triage system, making sure the most important areas are getting what they need.
Exactly. It's a pretty amazing system.
What about when the arterioles dilate? What's happening then?
When they dilate, it's like opening the gate wide open, allowing more blood to flow through.
So that would increase venous return then?
Exactly. More blood flowing through means more blood returning to the heart. And that dilation is super important during exercise.
Oh, because when you're working out, your muscles need more oxygen.
Right.
So those arterioles open up to deliver that extra blood.
Exactly. It's a beautiful example of how your body adapts to meet the demands you're putting on it.
It's pretty incredible when you think about it.
It really is. And, all of this is intricately connected to those capillaries and veins we were talking about earlier.
The ones that act as reservoirs for blood.
Exactly. They play a key role in how well this whole system functions. But we'll dive into that more in our next segment.
Oh, man, I can't wait. This is like a physiological thriller unfolding right before our ears.
We're just getting to the good part.
Okay, so we've been talking about all these amazing mechanisms that help get blood back to the heart.
It's quite a system, isn't it?
It really is. And in the last segment, you hinted that the veins themselves play a critical role in all of this.
Oh yeah, the veins are key players in this whole story.
What's so special about them?
Well, remember how we talked about capillaries and veins being like reservoirs for blood?
Uh-huh.
They have this incredible ability to stretch and expand to accommodate changes in blood volume.
So kind of like a balloon.
Exactly. If more blood comes rushing in those veins, can expand to make room, and that prevents the pressure from building up too much.
Oh, that's pretty clever.
It's a brilliant design. That ability to stretch, we call it venous compliance.
Venous compliance. Got it.
And it's crucial for maintaining healthy venous return.
So if my veins are nice and compliant, they can handle those surges in blood flow without causing any problems.
Exactly. No traffic jams in your circulation.
Okay, compliant veins, good. But I'm guessing like with a balloon, veins can lose their stretchiness over time.
Yeah, unfortunately that's true. As we age, our veins naturally become less compliant.
But it's not just about getting older, right?
Right. There are other things that can affect venous compliance too.
Like what?
Well, things like prolonged sitting or standing.
Oh, yeah, that makes sense.
Certain medical conditions can also have an impact,
Hmm.
and even some lifestyle choices.
So it's really important to take care of those veins.
It is. Because if those veins get stiff and lose their ability to expand,
What happens then?
well, then even if those arterioles are wide open, blood still can't get back to the heart efficiently.
Oh, I see. So it's like trying to force a ton of water through a narrow pipe.
Exactly. The pressure builds up and the flow gets restricted.
And in this case, that restricted flow is our venous return.
Right, and that can lead to all sorts of problems.
Like what? Aside from maybe feeling a little sluggish?
Well, if you think about it, inadequate venous return means the heart isn't getting enough blood to pump out to the rest of the body.
Oh, right.
And that can lead to fatigue, dizziness, even more serious cardiovascular issues in the long run.
Not good.
And you might also see swelling in the legs and feet because blood can pool in the lower extremities.
Okay, this is all starting to sound a bit scary. Is there anything we can do to keep our veins healthy and compliant? Or are we all just doomed to have stiff, uncooperative veins as we age?
No, you're not doomed. There's definitely hope.
Okay, good.
Regular exercise is one of the best things you can do,
Exercise.
especially activities that get those leg muscles working.
Like walking or running.
Exactly. It's like a workout for your veins.
Huh. I never thought of it that way.
Maintaining a healthy weight is also important,
Right.
and try to avoid those prolonged periods of sitting or standing.
So it all comes back to those healthy lifestyle choices.
Often the simplest things make the biggest difference.
This has been an amazing deep dive. I had no idea how much was going on behind the scenes to get that blood back to the heart. From those muscle pumps and breathing to pressure gradients and even the stretchiness of our veins.
It's a whole coordinated effort.
It really is. We've given our listeners a lot to think about today.
We have.
What's our final takeaway for them as they head back out into the world?
We've explored how all these incredible mechanisms work together in a healthy individual.
Mm-hmm.
But it makes you wonder, what happens when things go wrong?
Oh, like when someone has a health condition that affects their circulation.
Exactly. What about people with heart disease or diabetes? Those conditions can affect blood vessel function. How does that impact venous return? It's definitely something to consider.
Yeah, a topic for another deep dive, perhaps.
For sure. Always more to explore.
I love it. Well, thanks for joining us on this fascinating journey into the world of venous return. Until next time, keep those legs moving, those lungs breathing, and those veins happy.